Hey there, I'm Joshua Johnson at MSNBC World Headquarters in New York. Good to be with you tonight as we continue our coverage of the coronavirus pandemic. Across America, the nation now has more than 300,000 confirmed cases and more than 8,000 known deaths. Today, President Trump and the White House's coronavirus task force warned us that the next week will be very tough. The president remains impatient for the country to get back to work.
We have to get back to work. We have to open our country again. We have to open our country again. We don't want to be doing this for months and months and months. We're going to open our country again. This country wasn't meant for this.
Now, a big reason this week will be so significant is because of what we might see here in the tri-state area, New York, New Jersey, and Connecticut. New York has more than 113,000 cases. No nation in the world has more cases than New York State, except for Italy and Spain. Governor Andrew Cuomo says things will get worse here before they get better.
We're not yet at the apex. We're getting closer. Depending on whose model you look at, they'll say 4, 5, 6, 7 days. Some people go out 14 days. But our reading of the projections is we're somewhere in the 7-day range. It's good that we're not at the apex because we're not yet ready for the apex.
Meanwhile, New Jersey has more than 34,000 cases. That's the second highest total in the country. Connecticut has more than 5,000 cases. Connecticut's governor says the apex of the curve in parts of his state seems to be more than a month away. It's all kept first responders very busy, including here in New York. NBC's Alexa Liotto joins us from an EMS station in Manhattan's Chelsea neighborhood. Now, Alexa, a quarter of New York's EMS staff called out sick as they're getting more calls for help than ever. So how are they dealing with this there?
Hey, Joshua, good to be with you. This is a constant fight for resources on the front lines here. This is, you mentioned those numbers. I spoke with an EMT this morning who was out sick and had been quarantining himself and was worried about his own station, mentioning that 12 out of the 55 people that he worked with were also out sick. The way they've been dealing with this is, again, in multiple ways. The first is a repeated call for personnel. Mayor de Blasio calling for an additional 45,000 additional healthcare professionals to bolster the city's medical capacity. We received a alert on our phones yesterday calling for licensed healthcare professionals, again, to help the city's fight on the front lines and alleviate some pressure from these frontline workers. The FDNY also mentioned earlier this week that 500 EMTs and paramedics were traveling from around the country and volunteering themselves to help with this fight. But again, just speaking to some of the EMTs, some of the EMS workers here in New York, they're not only worried about their capacity and wanting to protect New Yorkers, but also making sure that they don't get infected and ultimately infect their families, which will inhibit them from doing their job. So just a lot of different angles there, Joshua, but really making sure that there's not only replenishing the ranks, but that they also have the resources to continue the work as this apex looms.
One of the big themes over the last few weeks has had to do with resources. New York's Governor Andrew Cuomo has said that the federal government should be coordinating the entire effort to get resources for all 50 states. Add to that, New Jersey having to bid against New York and Connecticut and California and Illinois and everywhere else. The mayor of Newark, New Jersey, said that his city can't compete with New York City for resources. So how is that going in terms of making sure that everyone gets the help they need, or are some places just kind of getting used to the idea that they won't get the help they need?
Joshua, it does seem as though there are states that are sort of on their own here, and New York specifically being the epicenter of the pandemic right now, again, has been putting out this call from resources. The governor earlier this morning, the press briefing that we heard just highlights the variety of players that New York State is working with in order to get the resources in order to take on this pandemic as it hits the region. We keep hearing about the need again and again for more ventilators. Today, it looked like the state was able to get its hands on some. Here's Governor Cuomo.
We got really good news today that the Chinese government is going to facilitate a donation of 1,000 ventilators that will come into JFK today. Also, the state of Oregon contacted us and is going to send 140 ventilators, which is, I tell you, just astonishing and unexpected.
President Trump also mentioning in his briefing that 1,000 additional military personnel would also be deployed to New York. We're also hearing that the NBA contributing with several other partners 1 million surgical masks to essential workers here in New York. Again, just highlighting the number of players that the state and the city are working with in order to gather these resources. And I think just in that briefing earlier this morning, Governor Cuomo saying that when Oregon or when other states do hit that their apex, the favor will be returned. So again, talking about how other states will ultimately potentially benefit from the lessons that New York is learning here and will potentially learn very seriously this coming week. Joshua?
Yeah, and he also made the point that this is exactly what FDR did back in 1940 when he was trying to get the Lend-Lease program started to try to explain to people, yes, I may need this resource now, but once my need is met, I will give it back to you. And even if I break it, I'll pay you for it. So we'll see how that argument goes in terms of getting more states to share their resources. Thank you, Alexa. That's NBC's Alexa Lioto here in New York. Well, let's go from the nation's largest city to its largest state, California. Los Angeles County just saw its biggest one-day spike in deaths so far. California has more than 12,000 cases statewide. At least 287 people have died from COVID-19. One of the state's big problems is getting people tested. Today, Governor Gavin Newsom described the low testing rates as frustrating and said he takes responsibility for that. Newsom announced a new public-private task force to tackle these delays.
We are now in a position where I can confidently say it's a new day, and we are turning the page on our old approach to how we coordinate, how we collaborate, how we organize, and how we distribute information to you in the public around the issue of testing.
Let's dig a little deeper with NBC's Steve Patterson, who joins us now from Los Angeles. Steve, what more can you tell us about this task force, particularly if it even knows the reason why these delays existed in the first place and if it knows what to tackle?
Well, I mean, so far in this crisis, Joshua, California has been praised by managing its curve, by being really one of the first states in the country to have and set true guidelines on social distancing. It's the reason why so many people say we haven't seen a crisis on the level of, say, a state like New York. But looking at the numbers, particularly today, we're starting to see that big jump, which is really signifying that we're entering in possibly to this new phase that so many have long predicted of seeing the virus's true potential. And this is happening while the state lags behind in testing. As you just heard, the governor has admitted essentially that there is a big lag, that they are lagging behind on testing. And so, you know, this is a state of 40 million people. You have fewer than 130,000 people so far tested for the coronavirus. Of that number, the number of people who have been tested, 13,000 people are still waiting on their results. This is big for a number of reasons. This is like trying to fight a war and not knowing where the front line of the battle is. So they have to improve this. That's what the governor's task force is now set up to do. He says they're going to address this by partnering with local hospitals, local lab clinics, local testing facilities and universities to try to determine and figure out where exactly these locations of spread are happening, to increase the number of testing locations. That's a big signifier across the state. And by doing so, hopefully eliminating some of these backlogs that have built up by increasing the number of locations, improving accuracy, and improving the data that we are getting and answering those questions that you asked. I think they need to build up in order to do that. The governor said the task force will eventually create a system which will increase daily testing almost fivefold. So this is good news, and it's crucial news, but we're looking at this as we're entering a new phase again, where we're seeing a bigger jump in the number of cases, a bigger jump in the number of hospitalizations, a bigger jump in the number of deaths, signifying that the true storm here in California is still to come. And this is a state in which we need at least about 50,000 more hospital beds by mid-May in order to accurately fight this, if all the models and predictions are correct. So we're still in a phase in which it's not our state leaders trying to get us out of the woods.
Right.
It's still them a month on preparing us to go into the woods, which is really tough to hear, and it's going to require some strong leadership in order for us to get through this.
That plus the fact that California is a gigantic state with many different regions that have many different needs and still has issues with income inequality and the homeless, and heaven forbid there's an earthquake or another fire. So it'll be interesting to see how California deals with its version of the fight against coronavirus. Thank you, Steve. That's NBC's Steve Patterson reporting from Los Angeles. Now let's head to Michigan. It has more than 14,000 confirmed cases and more than 500 deaths. Among the communities that seem to be suffering most are communities of color. According to ProPublica, Michigan is 14% black, 14%. Yet as of yesterday, African Americans made up 35% of coronavirus cases and 40% of the deaths. Joining us now is Democratic Senator Debbie Stabenow from Michigan. Senator, welcome.
Joshua, it's good to be with you this evening. And let me just start by thanking everybody who's doing their part to stay home, and most importantly, everybody who's doing their part to be on the front lines who can't stay home because they're a doctor, a nurse, a grocery store clerk, mail carrier, somebody working in corrections or in deliveries. There are a lot of folks that are out there on the front lines that are doing that for us, and the whole fight for us right now and getting the protective equipment right now is to protect them. That should be what our whole country, what our government, our national government is doing together.
Well, let me follow you on that before I ask you about the health disparities. How do you feel that Michigan is doing right now in terms of being able to get what it needs? President Trump has kind of sparred somewhat publicly with Michigan's governor for the last few days. But is Michigan, setting the politics aside, setting aside what we're hearing at some of the press briefings, is Michigan getting what it needs? Are parts of the state doing better than others?
No, we are not getting what we need at this point, Joshua. And I will tell you, after being involved in putting together the CARES Act, I've been home now the last 10 days, and I've spent almost all of my time on the phone working with our governor and her team, our congressional delegation on a bipartisan basis, reaching out to our manufacturers. I want to thank every single one of our 3 automakers and the auto workers for retooling their plants to make ventilators and masks, and other businesses retooling. But I have to tell you, I've been on the phone over and over and over again with FEMA, with Health and Human Services. The most hopeful call I had today was pulling together our Metro Detroit hospital CEOs, 6 of them, with Health and Human Services. And it sounded like we might finally get some things in the next few days. But we have been promised a lot, and it has not been showing up. And I will say one other thing after going round and round and spinning on this the last 10 days. You know, it's very clear that the whole philosophy of sort of anti-government privatization philosophy, that everything should go through the private sector, and then governors and hospitals should have to bid each other up, so that a 50-cent mask is now a good price, is $4 a mask. And we're now seeing $5, $6, $7 a mask.
Yeah.
So it's a philosophy that is crazy. It does not work when our country needs to be coming together in a health pandemic.
One of the things that's so fascinating about Michigan is how one side of one region can be very different from another side of the same region. I mean, you go around Metro Detroit and Wayne County and Oakland County and Macomb County, they're slightly different from one another, and the needs are quite different. With regards to health disparity that ProPublica reported on, obviously Michigan's not unique in health disparities between blacks and whites, but how do you see fighting that aspect of coronavirus? It almost feels like there are 2 fights in one. There's the virus, and then there's this legacy of inequality that is virulent in itself. What do you do with that?
You know, Joshua, this is so important, because what we're seeing now is what happens when we have that disparity and it's not been addressed. It's not been addressed in the underlying healthcare system, in our jobs, who are in the low-wage jobs, who are getting on the public bus and still having to go to work and not being able to socially distance as they should. I mean, the whole question of economic disparity, healthcare disparity, plays itself out in the most tragic ways when we are in the middle of this kind of pandemic. And I would hope that as we look at what we're going to do next on a fourth package and so on, that we are addressing those inequalities at this time, because it's not right.
Before we have to wrap, Senator, what's top of your list? Last 10 seconds, if you could ask for anything to help address this disparity. Last 10 seconds, what would you ask for?
Well, right now, I have to tell you, we need swabs and tests in Detroit to be able to protect people. We've got hospitals 2 days away from being able to do any testing. We've got too many nurses and doctors and folks working in our jails and at correctional facilities and grocery store clerks and on that do not have basic protective gear. It's wrong. They are being required to work on our behalf, and they should get that. And by the way, I think in the next package, we should be giving hazard pay to these folks, because it is frightening for people. I know in my own family, I have many people in those roles, and it's very scary for them.
Yeah.
Very scary for the family. And we need to be not only lifting them up in thoughts and prayers, but we need to be doing everything we can to protect them.
Well, my thoughts are certainly with your family and every family. I've got first responders in my family, too, so I can certainly relate to what you're talking about. That's Democratic Senator Debbie Stabenow of Michigan. Senator, thanks for talking to us. Now we focus on Arizona. That state has more than 2,000 confirmed cases of coronavirus and 52 known deaths from the disease. State officials are focusing on one of their most vulnerable populations, seniors. Sun City, Arizona has more than 50,000 residents who are age 55 or older. That's 70% of its population. NBC's Vaughn Hilliard joins us now from Sun City. Vaughn, how is that community preparing for a potential outbreak, especially with so many seniors who we know are statistically more vulnerable to coronavirus?
Seniors that are more vulnerable, and I think we're talking about something that is greater than those that are even potentially will contract COVID-19. We're talking about essentially the shutdown of these communities. You're looking at the greater Sun City area here in the West Valley of the greater Phoenix area. In the greater Sun City area, you're dealing with the population of retirees of more than 80,000 older folks in this one confined area. Just one block down from here is the Fry's Marketplace grocery store. You can't find toilet paper. So for most folks that are watching at home, you know, they're struggling to find these basic resources in even their own marketplaces. But when you're going into this grocery store down the road, I mean, I'm one of the older ones that walks in there, but you're dealing with the population that are trying to get their basic goods, their pharmaceuticals, their foods, their toilet papers, paper towels, and they're struggling to do so. And so while Arizona, you could say, is lucky right now for having just 2,000 positive tests, you could say just 52 deaths, you're dealing with the concern that could be paramount here over these next weeks. You know, Arizona governor's officials are expecting the peak to hit here by the late end of April, early May. I want to let you hear directly from Clint Hickman, though. He is the board, Maricopa County Board of Supervisors chairman here, which is the local jurisdiction that oversees the greater Sun City area. I want to let you hear from him in our conversation earlier what his hope and concern here in the Sun City area is.
They've lived through the Depression. They've lived through World War II, quite possibly, Vietnam, Korea. They're self-motivated to keep themselves safe. I also have some great worries about the assisted care homes that are scattered through this community in Sun City West and actually valley-wide. I am troubled by it. That is concentrated living of people that are in those golden years, but also those very susceptible years to catching this.
This is twofold, Joshua. You have at the government level, not only at the county level, but also at the state level, the National Guard, FEMA, that are working in U.S. Army Corps of Engineers, which are actively looking at sites around the valley to open up as potential field hospitals, kind of what you've seen in New York City, here in Phoenix, and here in Tucson. But then you're dealing with that second element, and that is the extent to which the local communities in places like Sun City will stand up and take accountability and look out after their neighbors. Right now, I think that's where the concern is. I was talking with a gentleman who's 78 years old, Steve Hess, who is currently staying at a hospital, or I should say staying at a hotel down the road, while his wife, who is also in her 70s, has COVID-19 here in Sun City, is at her home. He said that is serious. He has been talking with his friends here in the community, and they need toilet paper. Folks, there's not some big semi driving down the road tossing toilet paper out to people. And what they are having to do is literally go down to the grocery store and wait in line in the early morning hours with the hope that toilet paper is there. That reality is that is not the case. So while the government is focused on the mass production, the building up of these hospital facilities, I think by and large we're getting a true sense that it's going to take a lot of community activism in order to truly look after folks and their neighbors next door. Joshua?
Thank you, Vaughn. That's NBC's Vaughn Hilliard reporting from Sun City, Arizona. Now, Arizonans probably have some of the exact same medical concerns you have wherever you live. So let's unpack some of what we heard today at the daily White House briefing. Joining us to discuss it is Dr. Kavita Patel. She was the White House policy director under President Obama, and she is also an MSNBC medical contributor. Doctor, good evening.
Hi, good evening, Joshua. Thanks for having me.
What's your sense of where we sit in the curve of this outbreak? One clear message from the experts on the task force today is that this week is super important. Dr. Deborah Birx said that New York, Detroit, and New Orleans could hit their peak of cases this week, not of deaths, but of cases. And cases in Pennsylvania, Colorado, and Washington, D.C. are curving upward. What's your sense of where we are in this crisis and how much longer this might last?
Yes, Joshua, it's concerning all of us, and I'm tracking most of the major cities across the country. All of us are looking at what we're calling doubling rates to see how quickly new cases double. And in Detroit, Dallas, Nashville, we're seeing very concerning, anywhere from 3 to 4 days for cases to literally double. And so the White House and other experts and even my own colleagues on the front lines are all telling me that they're kind of bracing for this tsunami. Now, having said that, we also see glimmers of hope. There are parts of California, Boston. We know that if we can actually do aggressive social distancing and wash our hands, and on top of that, non-medical cloth-based masks, then we can actually try to bend this curve a little bit. But it is going to be, and I hate to say this, Joshua, but you brought up some important points around vulnerable populations. We are going to see the hotspots continuing until we actually acknowledge as a country that we need to breach some of these large brand disparities that we don't want to acknowledge.
Let me ask you about something the president talked a lot about this afternoon, which is a drug called hydroxychloroquine. It's a malaria medication that is being investigated as a possible treatment for coronavirus. Here's what the president said today.
It's been out for a long time. It's a malaria drug. It's also a drug for lupus. And there's a study out that people with lupus aren't catching this horrible virus. They're not affected so much by it. Now, maybe that's correct. Maybe it's false. You're going to have to check it out.
Well, I did check it out, and the Lupus Foundation of America says that if you have lupus, you're at higher risk for infections like the coronavirus, also known as COVID-19. Some people with lupus may also be at risk for more serious complications from catching coronavirus. So some of us did check that out. That does not appear to be true, but hydroxychloroquine is being investigated. What do you think about its prospects?
Yeah, look, I think that we need to take any ability to, deal with this virus and actually pursue it. Having said that, Joshua, all of it's investigational. And in fact, hydroxychloroquine, as well as the antibiotic that people have been talking about, azithromycin, are really only in early letters and early studies having benefits, and probably only in mild cases of COVID-19. And I'll just tell you, as an actual internal medicine physician. I can't even prescribe hydroxychloroquine for my lupus patients because so many other people have actually gone out and gotten prescriptions who don't need them. So you can see how this misinformation actually leads to pretty bad consequences for patients that have a disease for which we know we need that treatment. It's pretty bad.
There was also some push and pull between Dr. Anthony Fauci and President Trump in terms of how long the social distancing would need to last. We'll see how long that push and pull continues and how that affects the way we fight this pandemic. Dr. Kavita Patel is an MSNBC medical contributor and former White House policy director under President Obama. Doctor, thank you very much. Welcome back. I'm Joshua Johnson. Officials in Wisconsin are urging people to stay home with just 3 days to go until Wisconsin's presidential primary. Efforts to push back the date failed, even though Wisconsin is under a stay-at-home order. It has more than 2,000 confirmed coronavirus cases. Nearby Illinois has more than 10,000 cases, and that is where we find NBC's Shaquille Brewster joining us from Chicago. Now, Shaq, more than a dozen states have delayed their upcoming primaries due to coronavirus. Wisconsin did not. What happened?
That's right, and it's really just political dysfunction that you're seeing there in Wisconsin. As things currently stand right now, there will be an election on April 7th in Wisconsin. An in-person election. Polls will open at 7 a.m. and close at 8 p.m. But there also have been many court cases that are affecting what exactly happens and what we will see from that election night. Absentee voting, that in-mail or that by-mail absentee voting, that has been extended to April 13th. Now, Republicans in the state are currently appealing that decision, trying to bring back and just have one final election day on April 7th. But right now, people can still give their absentee ballots and submit those ballots up until April 13th by court order. The effect of that is that despite there being that voting day, that election day on April 7th, we won't know the results of the Wisconsin election until the 13th as things currently stand right now. As you mentioned, the governor of the state, Governor Tony Evers, he called for a special session on Friday. He tried to get the legislature back in session and tried to get them to act on his proposals, which included shifting this election day and shifting the entire election to an all-mail system where it's all vote by mail. The legislature, they came in, they gavelled in for about 10 seconds, gavelled out, and they moved on. They said that was not a serious proposal and said the time for proposals like that was several weeks ago when the crisis began. Joshua?
Yeah, President Trump was asked about all mail-in elections yesterday during the briefing. He was very stridently against them, really kind of went on a tear against all absentee voting. He also raised some eyebrows with regards to Wisconsin when he talked about an endorsement that he made. Here's what the president said.
In Wisconsin, what happened is I, through social media, put out a very strong endorsement of a Republican conservative judge who's an excellent, brilliant judge. He's a justice. And I hear what happened is his poll numbers went through the roof. And because of that, I think they delayed the election.
Concerned about people going to in-person voting?
I don't know. Why didn't he do it before? He's doing it right before the election.
But do you think
Excuse me. Why did he do this 2 weeks ago? All of a sudden, all of a sudden an election, which is taking place very soon, gets delayed.
Now, Shaq, if there has been a poll reflecting the impact of this endorsement, we have not yet found it. I wonder what your sense is of what will prevail here. Are politics going to prevail? Is public health going to prevail? I'm not sure which way this is going to go.
It's just not clear what will ultimately happen. And I can tell you that the local election officials and local leaders on the ground, they're expecting there to still be an election. Despite many of them, many Democratic leaders, I just got off the phone with one a little bit earlier, they're furious at the prospect of there being elections. An election official there said they're bending the curve, and that's what you're hearing flattening the curve. That's what you're hearing certain Republicans bring up and saying that, hey, they're making sure that things like hand sanitizer will be at these polling locations. They have procedures that the Elections Commission have gone out to and given to poll workers to wipe down equipment. There's one pen for every voter that will be allocated so voters can sign the voting roll, and then continue on with their day and keep that pen so people aren't sharing them. But despite that, what you're seeing is a true impact on the elections. Milwaukee, the largest city in the state of Wisconsin, in that city alone, they normally have about 180 voting locations. Yesterday, we learned that that number will be down to 5. That's 5 voting locations in a major city in Wisconsin. What will happen? That can lead to people crowding. That can lead to people who weren't able to get their absentee ballot in or don't want to vote by mail, prefer going in and voting on election day. That will lead to that crowding that you're going to see in the polling locations, and that definitely is not conforming with the own guidelines that you're hearing from the CDC and the White House itself. So we still don't know what's ultimately going to happen, but as things stand right now, there will be an election, an in-person election on April 7th in Wisconsin.
We'll be seeing lines of people standing at least 6 feet apart, possibly wrapped around the block to vote. By the way, quick reminder of your rights. If you are in line when the polls close, do not get out of line. The law says you have the right to vote. Thank you, Shaq. That's NBC Shaquille Brewster in Chicago. It is not the way that 1,900 people wanted to end their cruise, but eventually they just wanted it to end. Their ship docked today at the port of Miami. It left South America last month. The ship's owner confirms that 2 people have died. At least 11 others are in hospital with coronavirus symptoms. NBC's Sam Brock has the latest from Miami.
Tonight, news of another tragedy striking at sea.
2 of our guests passed away last evening while being treated in the medical center.
That recording comes from Peter and Grace Nam, 2 of the 1,900 on board. Their son, Paul, telling us he learned his dad tested positive for COVID-19 and didn't know for weeks when his parents would make it to port.
They got sick about 2 weeks ago. They were having symptoms of cold, fever, absolute nightmare.
This afternoon, that nightmare finally ended when the Coral Princess pulled into Miami with passengers carried out on stretchers. The ship's parent company, Princess Cruises, saying it's deeply saddened by the deaths and that guests requiring shoreside medical care will be prioritized to disembark first. Just 2 days earlier, 2 Holland America ships carrying 1,200 passengers, 4 dead and dozens sick, docked 30 miles away. Those passengers, like Laura Gabaroni and Juan Huergo, launched on a South American voyage at a time only a handful of coronavirus cases were confirmed on that continent.
It seemed like the only safe place to actually take a vacation in the whole world. And our own government that day was telling us that it was safe to travel and safe to live your life normally.
After 4 weeks of uncertainty, the couple reunited with their son Thursday night, something Paul Nam and other Coral Princess families also want.
Sad, angry. There were times where we were happy to know that they were okay on the ship, but once we got the positive test result, it's been heartbreaking.
Everybody has to undergo a health screening, and this disembarkation process is expected to last a couple of days. Eventually, 60 Floridians will be going back to their homes. 330 passengers are getting on domestic flights, and some 600 foreign nationals are returning on chartered plane. Joshua, back to you.
Thank you, Sam. That's NBC's Sam Brock reporting from Miami. Coronavirus has forced many companies to ramp up working from home. That includes us. Rockefeller Center is almost deserted these days. Telecommuting helps keep employees safe, but it can also complicate getting things done. How can companies endure this outbreak without sacrificing productivity, passion, or perspective? Good questions for Simon Sinek. His TED Talk on inspired leadership is among the most watched ever. His latest book is called The Infinite Game. Simon Sinek, welcome.
Thanks for having me.
I'm sure a lot of businesses are looking forward to getting back to normal, but this may be a more permanent shift than some of them would like. Our colleagues over at CNBC have reported on how some workers hope that telecommuting stops being a perk. And there are researchers at the University of Chicago who estimate that 1/3 of all jobs in the U.S. could be done remotely. So for business people who are shaking their heads or maybe shaking their fists and saying, I didn't sign up for this, what is the best thing they can do to adapt to this change?
So we have to remember that the fundamentals of leadership still remain the same, whether you're working from home or whether you're working at an office. And leadership is fundamentally a human thing. The best kind of leadership is eyeball leadership, where you roam around the office, you can make eye contact with somebody and you can have that physical proximity. Of course, we can't do that anymore, but we still have to remember the human side of it. We actually have to work harder telecommuting because we have to remember that people have that physical distance. So checking in on people when we're not on Zoom calls, for example, just to find out how they are, not just simply to drive work, is really, really important. Not just from our leaders, but from any of us. Just to call our friends, call our colleagues, and find out how they're doing helps keep spirits up.
Let's talk about your book, The Infinite Game. I've been enjoying reading it, and the book centers around this concept of finite games like baseball, known players, clear rules, fixed objective, and infinite games. Business, as you put it, is an infinite game because you can't know all the players. There is no one set of rules, and you don't win business, you just endure. Now, we hope coronavirus will not be infinite, but it can be kind of hard to think beyond the next few days with this outbreak. How do you balance short-term survival thinking with your vision for your business?
Well, this is a theory put forward by James Carson in the 1980s, and I've embraced it entirely. And it's essential for companies to maintain that infinite mindset. In other words, to think about beyond right now. At the end of the day, we're not going to win this. There's going to be other viruses in the future. There's going to be other setbacks, other technological changes that will shake a business at its core. Granted, this is more sudden than we're used to. And though we may get through this virus, there will be other things. And so for an organization to maintain an infinite mindset, meaning to understand that this is just a speed bump. Imagine if we lived for 1,000 years as opposed to 70 or 80 years right now. Think about it. This would be our 6th or 7th pandemic. In other words, we'd know how to deal with it and understand, even though it's difficult, like a hurricane, we are used to it. We've had it before. Companies need to think of themselves the same way. They need to think of themselves in a very, very long journey, of which this is a very difficult part. And it's an amazing opportunity for reinvention. That's the best thing that can come out of this pandemic.
You have frequently talked about companies that make their employees feel safe, whether it's safe to make a suggestion or safe to make a mistake or whatever. And these can feel like very unsafe times, especially here in New York. For workers and businesses and managers and executives who feel like nothing is safe, that they all just need to hunker down and pray for daylight, what would you say to them?
We have to remember that everybody feels stress and emotions differently. And so you may be in a great mood and in go mode today, but somebody else may be set back and stressed out. So I go back to what I said before. The most important thing is to check in on people. And the more that people feel like somebody cares about them as human beings, the more likely we are to rally as a team and focus on what we need to get done.
That's Simon Sinek. His latest book is called The Infinite Game, and do yourself a favor, go Google the TED Talk. It is worth watching. Simon, always good to talk to you. Thanks for spending time with us.
Thanks, Joshua.
Before we go, we'll take a look inside one of the nation's top hospitals. Doctors there are scrambling to keep people alive and to keep themselves safe. Stay tuned. Hey, do me a favor, when you and I are done with this, go set your DVR for tomorrow night at 10 Eastern. MSNBC will have an incredible documentary from our partner Sky News in London. Special correspondent Stuart Ramsey takes an in-depth look at the devastating impact of coronavirus on one of the hardest hit cities on the planet, Bergamo, Italy. Sky News takes us inside Italian hospitals, and you'll hear a critical warning that their medical first responders want the rest of the world to hear. Do not miss it. It's called Special Report Coronavirus Into the Red Zone. Go set your DVR for tomorrow at 10 Eastern here on MSNBC. The president has said that states and the federal government should have prepared better for a pandemic. That is exactly what Massachusetts General Hospital did. Mass General is Harvard's primary teaching hospital. Contrast that preparation with this landing at Boston's Logan Airport. The New England Patriots team plane brought 1.2 million N95 masks from China. It's the kind of life-saving equipment that hospitals desperately need, including Mass General. NBC's Stephanie Gosk has the story.
Boston's Mass General, one of the nation's leading hospitals.
We're stuck here.
A month ago, NBC News was given an inside look as their emergency command team was gearing up for a possible pandemic.
I think there's no question that we are better prepared than we ever have been.
On Saturday, the first death was reported in the United States.
Just 4 weeks later, the change at Mass General is stark.
I would say this is following our worst case scenario in terms of pace, in terms of how fast this is evolving.
Leaders at the 200-year-old institution have been preparing for a pandemic since the SARS outbreak in 2003, including an emergency stockpile in a secret location. This looks like a lot of stuff to me, but how long is this going to last?
The goal was to give us about a 2-week buffer.
2 weeks?
2 weeks.
That's not a lot of time.
It's not a lot of time.
And now the frightening reality. With coronavirus cases doubling roughly every 2 to 3 days here, Mass General has already tapped into its emergency supplies. Masks, sanitizers, face shields.
We're trying, of course, not to use it all right now. We think we are still several weeks away from the potential peak of the outbreak.
The hospital has 150 critical care beds. They are scrambling to increase capacity, turning other units into ICUs.
We can get up to about 300 or so with the extraordinary efforts we've taken.
And there are other shortages, like the swabs needed for testing, the hospital pulling supplies from nearby research labs. In the pharmacy, shortages of drugs to treat COVID-19 patients, including asthma medication.
We've struggled to get some of what we call meter dose inhalers of albuterol.
And concerns about drugs that are being tested as potential treatments, like hydroxychloroquine, an essential medication for patients with lupus and arthritis. And then there are the ventilators.
We've identified more than 200 additional ventilators that we're looking to bring on board.
But if they run out, the hospital has a last resort plan.
We can actually take the tip of this and put it on a T-piece to connect it to 2 people if we had to.
People can actually share this?
They can share it in very rare circumstances. Now, it's very hard to do. You and I breathe at different rates right now, and to put us on a ventilator, we have to breathe at the same rate. That requires us to be sedated, paralyzed, requires other interventions we would not normally do.
But nothing is normal anymore. Last week, a New York hospital made headlines when it began sharing ventilators. Mass General is not there yet, but they are bracing for it. Meanwhile, their staff remains committed as ever.
It's not to say people aren't tired. It's not to say people aren't scared. But I've yet to hear a single person say, I can't get through this. I think people are just putting their heads down and doing what they need to do.
That's NBC's Stephanie Gosk reporting. As of this morning, Massachusetts General says at least 189 employees, clinical and non-clinical, have tested positive for COVID-19. And that is our look at coronavirus across America. I'll see you back here tomorrow night at 9 Eastern before that special report from Sky News at 10. So until we meet again, I'm Joshua Johnson. Thank you for making time for us on MSNBC. Stay safe and stay sharp. We'll get through this. Good night.